are web streamed and televised. We are going to start today with the Board of Health, and that will be immediately followed by the Budget Committee, and then Council and Committee today will begin at 1 p.m. I will now call the Board of Health to order and welcome all members to this board meeting. If I could have a motion to approve the agenda. The only change I would like to note will just be the order of the speakers. Dr. Strauss is running late, so we're going to have Stephanie do her report first, followed by the update from the Medical Officer of Health. So if I could have a motion to approve the agenda as presented. Councillor Taylor, thank you. Seconded by Councillor Michele. All those in favor? And that is carried. Any declarations of pecuniary interest? All right, seeing none, then Stephanie, welcome. I think we're going to start with your report first, which is HSS 2118, the Annual Service Plan Budget Submission and Funding Update.
Okay, can everybody hear me? I'm using my phone.
Yep, we can. You're good.
Okay, perfect. Okay, so good morning, everyone. Good morning, Madam Chair and board members. I'd like to thank you for the opportunity to speak with the board about Report HSS 2118, which is the Annual Service Plan Budget Submission and Funding Update. This report provides information on the current public health funding and the accountability agreement received on July 22nd, 2021, and requests approval of the funding received to amend the current operating budget. On April 1st of 2021, the health unit submitted our annual service plan. The service plan describes our existing services planned as per the Ontario Public Health Standards and reflects programs that are cost shared and 100% funded by the Ministry of Health. The municipal cost share is 30% for public health programs and services, with the exception of the Ontario Senior Dental Care Program and the Medical Officer of Health compensation. The accountability agreement utilized for the submission was received on January the 5th of 2021 and included both provincial and municipal sources of funding. This year, due to increased demands regarding COVID-19 response, the ministry scaled back the 2021 submission template and only requested that public health units complete financial sections and one-time requests for funding. The submission included no additional base funding requests and was limited to 6 one-time requests, which included COVID-19 extraordinary costs and the COVID-19 vaccine program costs. Similar to previous years, the submission does not include the Healthy Baby, Healthy Children program funding provided by the Ministry of Children, Community and Social Services. A summary of the health unit submission includes a base program submission of $8.9 million for 2021 within the existing Board of Health approved budget and 6 one-time funding requests totaling $8.17 million. In July of 2021, we received notification that for the 2021-2022 funding year, the maximum funding available under the agreement is $11,323,400. Table 1 in the report illustrates the 6 one-time funding requests submitted and the monies received. With request number 1, we have now added this request to the 2022 capital budget and will not go forward unless approved by the Board of Health. With requests 2 and 3, the ministry has given us an initial allocation as a percentage of our one-time request, and the ministry is committed to fund all eligible COVID-19 costs, both extraordinary and vaccine. With request 4, the ministry has also communicated they will fully fund this request. Table 2 illustrates our base funding allotment received, which has remained the same as our 2020 calendar year allocation. And we also received additional one-time funding for 2021-22 that was not applied for within the service plan. And this is found in Table 3 of the report. Of note, the ministry has committed funding for the COVID-19 school-focused nursing initiative for the 2022-23 fiscal year, with the program slated to end July the 31st of 2022. Table 4 illustrates the approved allocations and budgeted allocations with a total variance of $4,010,500. As a further update, on November the 3rd, we received notification from the ministry regarding additional one-time funding received. A memo will be revised to include this allocation received from the ministry and will be provided at the next advisory and Board of Health. So to conclude, there are 3 recommendations for the Board of Health: that the report be received as information, that the approved 2021 Baldwin Norfolk Health Unit operating budget be amended to include $4,010,500 in one-time funding, and that the Board of Health ensure the delivery of one-time funded programs as outlined in this report. Thank you.
Thanks, Stephanie. Any questions from the board? Seeing it. Stephanie, just only question from me. Within that extraordinary cost, was there a portion of that was salary salary top-up submissions to the ministry, overtime submissions?
So the extraordinary costs do include overtime submission as well.
I guess just a question.
Just to conclude, for staff, if that's what you're asking.
So I guess, you know, the last time that those submissions were made, the board had approved it was a fixed amount. So what is occurring now? And previously, we had always been presented with a report of what those overtime submissions were for. So this is overtime for management staff?
Through the chair, to Madam Mayor, no, it's not overtime for management staff. It's for staff, frontline staff.
For frontline staff. Okay, yeah, very good. Any other questions from the board? Right, if I could have a mover then for the staff recommendation. Member Taylor, thank you. Seconded by Member Martin. Any further discussion on that? All those in favor? And that's carried. Thanks, Stephanie, for joining us. Dr. Strauss, I see you have arrived as well. Welcome. And with that, I will turn it over to yourself, sir.
Okay. Thank you, Board Chair Chop. It's nice to speak through you to everyone here. I had been under the impression until a half hour ago that we were going to meet in person, so I'm sorry we've not yet had the opportunity. In terms of a COVID update, I think I'd like to be less dramatic than to say welcome to the fifth wave, but it seems like that is what is happening both provincially and in our community. As a physician, I'm prone to delivering good news and bad news. The bad news is I think this could be a significant wave with the pace that the cases are going right now, and also with whatever amount of seasonality has been observed with this virus so far. We had a very significant wave in which cases started to pick up right around this time last year. So in some sense, we are right on time. That's the bad news. The good news is our vaccine program has been a tremendous success, and all of the data from every country, but also provincially, shows that the vaccines that we have received, or at least 85% of us in this community, provide powerful and persistent protection. So although cases are likely to go up, perhaps at times at a startling rate, those of us who are vaccinated are very well protected against an unfortunate outcome. My major message to folks, included in the press release and the media call I did yesterday, is if you have had hesitations about the vaccine, if you did not want to be the first in line, if you wanted to give it 6 months to see what happens, now is the time to go get vaccinated. We now have 6 months of data in Ontario. We have 6 months of experience. I continue to be perturbed about, I've often mentioned the 40 to 60 age group where we have this bit of a lag in our local immunization rates. That lag persists, has gotten better, but in particular, the age bracket of 55 to 60 has quite a disappointing vaccination rate. But I think as we steel ourselves for what's to come, I think being comfortable that if you are vaccinated, you are well protected, and it is for the sake of the unvaccinated that I want them to get vaccinated, rather more than for the sake of myself. That's the major COVID piece. As you know, or as you may have heard, the cases in our counties are predominantly in the Dunnville region and the Langton region. And Dr. Bishop Williams, our epidemiologist, has done some thinking and some describing about hyperlocal phenomena, and this is not this was not necessarily unexpected, that in relatively rural, relatively unvaccinated populations, it kind of is just a matter of time before the virus gets in there, and when it gets in, it can be a little bit impressive.
Matt, I think we just lost you. When it gets in there, it can be a little, and then you were cut off.
It can be impressive, and it can proceed in this sort of pocket-based manner. That said, it is important to note that cases are up provincially, and also yesterday I was looking at cases on in each of the United States that also surround Lake Erie, so Ohio, New York, Michigan, Pennsylvania, and all four of those are seeing a spike. So I think that there are some local phenomena at play, but we're also part of a broader picture, not just in the province, but in the geography, let's say. So that's the major COVID and case count update. Beyond that, I anticipate that given our conversation at the last Board of Health meeting, that you would have questions about migrant farm workers and restrictions of that sort. My message is very similar. The vaccines provide powerful and persistent protection, and we need to make sure that our thinking and our regulations take that under account. So over the last couple of weeks, I've had a number of meetings with the public health staff and management, trying to devise a plan that makes sense with this vaccine piece being the cornerstone of our thinking. I've also engaged the other local MOHs, particularly those who have high populations of migrant farm workers in their communities. And while I cannot announce precisely what the regulations will be at this time, because public health staff want more time to prepare communications and this sort of thing, what I can say is that we are all in agreement that restrictions will be loosened, and they will be largely in keeping with neighboring counties, and final announcements will be made on or around the 15th of December. I think those are all the updates that I had to give you, and I'm very pleased to take your questions.
So as public health, I'm just going to start with a quick question. As public health goes to make that decision, then this is on, I'm assuming, the basis that, all migrant farm workers are arriving are going to be vaccinated. That was the last that sort of I had heard was, the farmers were seeing success because they had to provide their list of workers that would be arriving next season. And so it looked as though the only way they were going to be allowed to arrive was if they were vaccinated. Have you heard anything to that end?
My understanding, and I don't want to misspeak because there's a whole bunch of agencies and different levels of government involved, fortunately or unfortunately. My understanding is a final determination of that has not come from the federal government, but all signs are pointing to it is very likely. I have also heard from certain farmers that they are personally not interested in having folks come who are unvaccinated. So at this time, I think it's most appropriate. I would support the federal government making that regulation to their program. I think most of the farmers would. I think most of my MOH colleagues would. But for now, the ball is in their court, and that's the serve that we're expecting, I suppose.
So to that end, in the event that they do not make it mandatory, do you see, as far as changing that underlying order with restrictions in Norfolk County, kind of a two-tiered approach, one for bunkhouses, which are composed of fully, vaccinated migrant workers, and others for bunkhouses where perhaps they have not been vaccinated?
I think that would be potentially sensible. I think that if we do that on a local basis, there are operational issues that would need to be ironed out. So I think for everyone involved, our hope right now is that the federal government will take that lead.
And I just have one more question, sorry, for the board. Given that we're consulting with other MOHs with migrant workers within their jurisdictions, and Dr. Nessathari is now in Windsor, have we seen any changes come out of Windsor in recent times, given that they have the
I'm
Other
not
largest
aware of any.
farm worker?
Yeah, I'm not aware that any changes have occurred in Windsor, Essex. When I last met with the management and PHIs, the most up-to-date information they had, and this was about last week, but was that no changes had been made.
Any questions from the board? No. Councillor Van Den Riche, I think I saw your hand go up there first. Yeah, go ahead.
Thank you, through you, Madam Chair, to Dr. Strauss. I'm quite concerned about the Langton area. I am starting to hear more and more of that. Is there a plan of, because of our demographic down here, to get to, say, some of the organizations or whatever, to encourage more vaccination? Is there a possibility of that?
There has always been a plan. There has always been ongoing work. Chief Page pardon?
We have a strong German Mennonite population here. Is there getting to some of the churches with information, or just to try to encourage more vaccination and to, there's, like you say, there's a lot of myths out there, and maybe a way of speaking to them that we can encourage them to get vaccinated, and the local population.
Thank you, Councillor Van Den Riche, through the board chair to you. That work has been ongoing all along. I know of some conversations that the public health staff were having with particular churches in that area throughout the week. So that engagement has been difficult in the sense that trust takes some time to build, but we have been doing everything we can to make those engagements and build that trust and have those conversations. So yes, the short answer is yes.
Yeah. The next question I have, if I may, how about the schools? How are we doing with the schools in the sense of, have we had any breakouts? Is there breakouts? Has there been any of our schools potentially with a shutdown, or how are we looking with schools in the whole unit? And I'm talking about Haldeman and Norfolk.
Right. In my time here, there have been multiple cohorts dismissed, and there has been a school shutdown. My understanding is that it had long been the policy of the public health unit not to announce school outbreaks. Okay. I understand because of concern. It is children that we're dealing with and confidentiality, and also I think that there has to be a public health rationale. So if 500 people go to a grocery store and they don't have a list of who it was, we can't get in touch with them any other way than a press release saying, if you went to this grocery store, you might have been exposed. In the case of schools, we have a list of the students. We work closely with the school administrators, and we make sure that proper advice goes out to all of the students and their contacts. So yes, there has been a school shutdown. We worked very closely with that school. We reviewed their infection control practices. We dismissed students first by cohort and then by the whole school, and then isolated contacts of positive or probable cases in accordance with ministry guidelines. There's another school outbreak under investigation currently.
Stephanie
is now joining.
So my observation is that unfortunately this has become a little bit old hat. We know what to do when there is transmission observed in schools, and we're doing it much as we did over the last 14 months and before my time here.
Okay. Just checking, because we want to make sure that we're ahead of the game rather than behind. Thank you.
Councillor Shelley, go ahead.
Thank you, Madam Chair. Good morning, Dr. Strauss. You mentioned that we are in a fifth wave, and we're going to continue, of course, to encourage those unvaccinated people to get vaccinated. Do you anticipate a further increase in these numbers given the seasonality that you referred to earlier? And if that's the case, do you anticipate, or are you considering any additional measures to stem that tide?
Thank you, Councillor Michelli, through the board chair to you. Prediction is fraught. I try to not make predictions that I don't have to. But yeah, to reiterate what I said earlier, I suspect that cases will continue to rise provincially, geographically, and also in our health unit. It just merely stands to reason that in Canada during the winter, rates of respiratory virus transmission have always gone up. I am in close contact. I'm frequently at public health meetings with provincial officials. I'm frequently at meetings with other MOHs. The overall direction of the province is not to reintroduce restrictions. There may, some things are left to local discretion, of course, but that is the general direction of the province. During my media call yesterday, I explained that in my 10 years in the hospital, sometimes folks would not take my advice. Sometimes they would leave the hospital against my advice. Sometimes they would have a bad foot infection, or they would require oxygen and intravenous antibiotics. And I would say, you need to stay in the hospital. And they would say, no, I need to go to my grandmother's birthday. And they would leave the hospital against my advice. I have always tried as a physician to welcome them back when it doesn't work out, and when they come in and make a maybe more thoughtful healthcare decision, to support them in doing that. I think that given how amazingly effective these vaccines are, given how much has been done to make them accessible, to provide education, and even some of the restrictive policy measures that have been put in place, I think on a provincial level, there's not much more that can be done to coax unvaccinated individuals to become vaccinated. And I think at some point there has to be an acknowledgement that we cannot keep shutting down society, stopping the economy, stopping education of school children, these sorts of things. Acknowledging that when cases go up, when future waves occur, it will primarily be the unvaccinated who bear the healthcare consequences, or the health consequences of that. So in the past, when restrictions were
now joining
in order to preserve healthcare system capacity, let's say, I think with 85% of the population vaccinated, that would not be a concern. I mean, our healthcare system is always rather overburdened, but we're just not looking at that sort of system-wide collapse from increased cases in the fifth wave. So to answer your question, in general, we keep our powder dry, everything's on the table, but no, I'm not anticipating that either myself or the province will be bringing back widespread restrictions.
Thank you, Dr. Strauss.
Any further questions? Member Columbus, go ahead.
Yes, thank you, Madam Chair and Dr. Strauss. As you know, for the past 2 years, our farmers have been dealing with a great deal of mental anguish when it came to meeting the transportation and the housing stipulations for the migrant farm workers. And right now, I'm very pleased that you are in place to kind of work with the other health units and the senior levels of government to make things go smoother, which is very important. And I think our farmers that have migrant farm workers are very pleased that you're here to make those changes. Thank you.
I know that wasn't a question, but if I could respond, Councillor Columbus, through the board chair. I think, so I've heard a lot from farmers, I've heard from the public health staff, I've heard from other MOHs, including my predecessors. I think that some of the mental anguish, if not a lot, most of the mental anguish, the farmers I've spoken to all wanted to follow the rules and were particularly perplexed when there seemed to be contradictory rules. You couldn't get, you couldn't get the flight code until the feds gave you this, but you couldn't get the thing from the feds until the public health unit gave you that. And it's unfortunate that, from my understanding, in the spring of 2020, I don't think the federal government had the bandwidth to pay attention to this relatively local issue, local in several localities, but local. So each locality was kind of left to fend for themselves and come up with something. And then the year after, the feds brought in what they thought it should be, but it just was not time to synthesize that with what local governments were doing. It seems to me that now the federal government is quite on the ball with this issue. And my hope is that the more we can allow to happen nationwide, the less farmers will be dealing with these sometimes contradictory regulations. So
is now exiting.
I think that will relieve a lot of the angst that you mentioned.
Any further questions from the board? Member Van Den Reesche, go ahead.
Thank you. Just a comment. Yes, many of the farmers that I've spoken to have done a tremendous job of encouraging their offshore to get vaccinated. And I think many of them in their own countries will probably have regulations that will come to stimulate them to get their vaccination before they come. So I'm looking forward to a better year next year, and I know all our farmers are as well. So again, thank you, Dr. Strauss, for all the work you're doing. And it is important that you continue making contact with our farmers. Thank you very much for that.
Okay, thanks everyone. Any further questions? Member Van Passen, go ahead.
Thank you, Madam Chair, and through you, just on that sort of subject, previously this board had, and our medical officers health had written a letter to the feds. The federal government is sharing vaccines with less fortunate countries around the world, and we had asked that they put that emphasis of sharing vaccines with the source countries that the workers who arrive here come from. And I'm wondering if the medical officer's health has done any follow-up with that or resuggested that, because I did note that the feds are now distributing some of our vaccines to other countries. So, I still think that should be a priority to get our vaccines to the country where the workers come from, and it would benefit all of us, our country and theirs. So I wonder if there's any comment from the doctor on that.
Thank you, Board Chair, through you to Councillor Van Passen. I, in fact, wasn't aware that letter to the federal government had gone out. I know a lot has happened between then and now, so that was not handed over to me. I support in principle this idea. We're in some ways we're very, very lucky to be in a situation where we're considering booster doses. We're kind of, if you've had your 2 doses, you're kind of 9/10 protected, and trying to boost that up to 100 is a very fortunate position to be in when many developing countries do not have much more than 10 or 15% of their population vaccinated. So I definitely support the sentiment, and I can do some follow up on where that ended up with the federal government. Of course. Thanks.
Member Martin, go ahead.
Through you, Chair Chop, to Dr. Strauss, on that note of boosters, could you just provide us with a very brief explanation for the public around booster shots and third doses and why they're necessary and what benefits are derived from them? We're hearing a lot of negativity, I would probably suspect, from unvaccinated community members about how the first 2 doses weren't good enough. Can you share a little bit of the science behind that and debunk that third booster?
Thank you, Member Martin, through you to the board, or through the board chair to you. I'm sorry. So on background, the 2 doses of an mRNA vaccine, those being Pfizer or Moderna, provide in excess of 90% protection from hospitalization or death from COVID-19. And the preponderance, I say over 90, based on my read of several studies, the average winds up being about 95%. In my personal clinical experience, I can say that I have at no point since the vaccines came out did I admit any person who was fully vaccinated to the ICU with COVID-19. So I haven't seen one breakthrough case clinically that that became critically ill. Since I've been at the public health unit, and in some of what I've read from other public health units, there are some breakthrough cases, that is, cases in vaccinated individuals who do have a significant problem, but this is very, very rare. So I think that you still have that 95% protection. Perhaps if you're very elderly or very ill in other respects, it might start descending to the low 90s or high 80s, but that is still really fantastic protection. And to get you back up to something like 95%, the booster is indicated. But it is not because the second dose became ineffective. The second dose is still 90% effective, which in terms of medical therapies that I have prescribed in my life, 90% effective is terrifically effective. So I wouldn't want to make perfect the enemy of the good. I think 90% is great, 95% is better. I'm not aware of any level of government, in terms of folks who feeling like their back's up against the wall, and if I get one vaccine, am I signing up for a lifetime of boosters? I am not aware that any level of government anywhere in Canada is considering making third doses mandatory. And personally, I wouldn't support that move myself if that idea was ever raised. So those who are unvaccinated, who are saying, why do I need to get a first shot if a second isn't even effective and I'll just end up getting a third or every 6 months? I don't think that's the case at all. I think get 2 shots, call yourself 90% protected. That is fine by me. If you want to be 95% protected someday, and I should say you are 95% protected until about 6 months later, if you are very elderly or very ill otherwise. So I hope that's an ample debunking.
And further to that, is it not common that there are other vaccinations totally unrelated to COVID-19 that do come in with additional boosters? Maybe not as quickly, but it's not an uncommon practice to go and renew shots or build on them. Is that correct?
Yeah, I would have a hard time saying anything more emphatic on that point because COVID is new to humanity. It is only 2 years old now. Obviously, folks get a flu vaccine every year, so it's not unheard of. When I got into med school, I had to get some of my childhood vaccines boosted because there were no antibodies in my blood. So I had my measles, mumps, and rubella, I think 2 more times. So yes, there is some precedent for booster shots. It could be that 10 years from now, we say that the COVID vaccine is primarily given as 3 shots. It could be that we say it's primarily given as 2 shots. It could be that it's given as 1 shot when you're 18, and we kind of assume that everyone is exposed to it in childhood. Like there's a lot of ways this could play out 10 years from now, and I would have a hard time predicting what it will be.
No, that's fair. Thanks for your comments on that.
All right, I don't see any other hands. Thanks very much, Dr. Strauss, for joining us. If I could get a mover and a seconder to receive the Medical Officer of Health update as information. Member Columbus, seconded by Member Van Passen. All those in favor? That is carried. We just have one set of minutes to go through an approval here. Let's see here. The minutes of October 6th that have been presented. Are there any errors or omissions? Okay, seeing none, then if I could have a motion to adopt those minutes as presented. Member Vanden Riese, seconded by Member Taylor. All those in favor? That is carried. Of communications, I don't believe there's any general announcements to be made. So with that, if I could have a motion for the confirming bylaw, which is 2021-22 BH, being a bylaw to confirm the proceedings of the regular Board of Health for this Halton Norfolk Health Unit. At this Board of Health meeting held on the 9th of November 2021, that they be approved, signed by the Mayor, Chair, Board Clerk, and affixed with the corporate seal. Member Michelli, thanks. Seconded by Member Rabbits. All those in favor? That is carried. And finally, a motion to adjourn. Member Martin, thank you. Seconded by Member Van Passen. All those in favor? That is carried. So I'm going to suggest we take a 10-minute break. We'll start back up here at 9:50 for our rate supported budget. approval. Are there any additions to the agenda from council members? Okay, seeing none, then if I could have a mover and a seconder to approve the agenda as presented. Councillor Rabbit, seconded by Councillor Taylor. All those in favor? That is carried. Thank you. Any declarations of pecuniary interest? All right, seeing none, I do have some opening remarks that had been prepared. Councillor Vanden Riche was originally going to chair the meeting here, but she may have to head out. So just to note a couple of items that the 2022 rate budget highlights include, first of all, an increased infrastructure funding levels, an otherwise largely business as usual budget that aligns with the long-term plan adopted last year, and predictable rate increases that are consistent with those from the rate study. It is my understanding that the goal of today's budget committee deliberations will be to continue the plan adopted by this council last year to move towards long-term financial sustainability for water and wastewater services. The approval of this budget, the next step of the plan, will help secure a solid foundation for success by providing for asset management needs. Though significant strides have been made, it will be critical to keep moving in the right direction, and that is what we will strive for during our review of the rate-supported operating budgets today. With that, I will now move into our agenda, and we'll start the meeting with our deputations this afternoon. So the first deputation we have will be from Stephen Nunn, and this is in regards to the Linwood Arts Centre 2022 budget. So just a reminder, Stephen, that you will have 5 minutes to make your presentation. And with that, I will turn the floor over to yourself. Stephen, are you on the line still? I know I did see you earlier.
Am on the line. Sorry, I was muted.
No problem.
Does everyone have the deck that was sent out earlier? I'm not sure.
The one that was included with the package?
Yeah.
That deck?
Yeah. Okay, great, because I'll be referring to it, so I just want to make sure everyone has it. So thank you. My name is Stephen Nunn, and I'm the treasurer of the board for Linwood Arts Centre. Firstly, let me say thank you for your support of Linwood Arts Centre this year. The initial funding we received allowed us to start building the infrastructure to engage donors so that we can bring access to arts and arts programming to Norfolk residents, as well as become a hub for the revitalization of downtown Simcoe and its riverfront. We embarked on this partnership earlier this year, and both Jason Burgess and Mayor Chop expressed optimism that we could become a model for partnerships between the county and community organizations such as ours. And although it's early days, I think we're on the right path. As agreed in our memo of understanding, I'm here to present Linwood's annual budget for 2022. Working with the county staff, they have helped us put the budget into a format that you're familiar with. So let's turn to that document, and since I only have 5 minutes, I'll just focus on a few key items. So let's start with what we achieved in 2021, which is noted on the bottom of the first page of the deck. Firstly, and most importantly, we developed a partnership with the county in support of a 5-year strategic plan, and we continue to work with the county team to implement the terms of the memo of understanding. Secondly, we hired a development manager to lead programming, exhibition development, and grant proposals. Samantha Purvis started in August and has put together a great plan for 2022, which will help with our conversations with potential donors. Speaking of which, about a month ago, we engaged Kim Shippey as a fundraising consultant to develop a fundraising plan. Kim is well known in the community and has an extensive fundraising background. She's really hit the ground running to help us start to develop a sustainable fundraising structure, and we're very excited to have her on board. We executed a survey to identify areas of the community's needs, and feedback was very positive, as you can see by some of the quotes noted. And we created a tenancy agreement with the Catholic School Board in support of their arts programming. This is exciting because it not only brings in revenue for us, but the school board has agreed to provide volunteer hours, so it truly is a partnership. And finally, we've submitted a couple of grant proposals in support of programs. Unfortunately, one of those was not accepted, but we are expecting a positive response on the second. On the top of the next page, you'll see that in 2022, we plan to continue to implement our fundraising plan to develop a sustainable donor program. We want to hire our contract development and operations manager for the full year, establish a robust volunteer base, develop and deliver arts programs, exhibitions, and events, and establish new community partnerships. I've also noted our challenges on this page, and would just like to highlight the second item. Due to the timing of the defunding of Norfolk Arts Centre, the Linwood Arts Centre is not eligible for any COVID relief grants. Unfortunately, we are seen as a startup organization with no pre-COVID operations. In addition, the Ontario Arts Council funding is not available to us until we have been operating for 2 full years. So let's turn to the budget summary and our funding request on the last page. I've laid this out with the first column representing our budget expectations when we received the funding earlier this year. The second column is our budget for 2022. The third column compares the 2 years, which I've done on an annualized basis. So in other words, took the 6 months of 2021 and just doubled it when comparing it to 2022. And finally, on the far right in the gray are the 2021 actuals. And now that we have some time under our belt, we have a better perspective on what those costs really are. And some of them are just one-time startup costs and won't be considered for our 2022 budget. For the 2022 budget, the big increases are in salary, which would cover a full year for the development manager and a half year for a fundraising consultant. The other increase is the cost for programs and exhibits, which we didn't have any in 2021, so the total, of course, that would increase. And the total expenditures is $249,650. Revenue side, we expect to be able to raise $156,000 in 2022 through grants, program and rental fees, as well as fundraising. This is aggressive, but we believe it's achievable. And this leaves us with a request for funding for 2022 of $93,650 from the county, which demonstrates that we are moving in the right direction. It's a 6.4% decrease annualized from the funding we received last year, and of course, considerably less than the $350,000 that the Norfolk Arts Centre was costing taxpayers. In conclusion, the residents of Norfolk have spoken loud and clear that they feel Linwood is a vital part of Norfolk County. With the county as a partner, we can build the infrastructure to engage sustainable donors so that we can bring access to art and arts programming to Norfolk residents and support the revitalization of downtown Simcoe. We look forward to your continued support as we move forward. Any questions?
Thanks very much for that. Questions from the committee? Councillor Columbus, go ahead.
Yes, thank you, Madam Chair. Very good presentation, Stephen. My question is with respect to volunteers. How many volunteers do you have engaged in the whole concept of revitalizing the Linwood Arts Centre to date?
So today it's been focused mostly on the board. We have identified a number of people who have put their hands up for it, but without programs and understanding how we were moving forward, it was hard to really bring them in and start using them. We actually met this Saturday and did a strategy discussion on how we were going to start building a database of volunteers and start building that out so that we can have people who put up their hands for events, people who put up their hands for fundraising committees or that kind of thing, so that we know specifically who's available for what.
Thank you.
Councillor Shelley.
Thank you, Madam Chair. Stephen, yes, thank you for your deputation today. Stephen, I have a question about the tenancy agreement that you have with the Brand Haldeman Norfolk Catholic District School Board. And forgive me if I have missed it, but I have looked over this several times. Can you give us an idea of the length of that tenancy agreement and also the actual amount of revenue that it will create?
So the length of the agreement is, it started in October, so they're already in, and that goes until the end of the school year. So the expectation is that if it's successful, that'll get repeated next year, probably September to June. They are paying $15,000 for the use of the space for 3 days a week. And of course, it's during school hours.
Okay, thank you, Stephen. And Madam Chair, if I can ask a further question. Stephen, with regard, because that sounds like a very good arrangement, and it sort of is a benefit to both parties in a very positive way. Have you reached out to the other school boards in the area? Specifically, I guess I'm thinking about the Grand Erie District School Board, but also perhaps Marie, the French Immersion School in Simcoe?
So we haven't yet, but we do have a plan to do that. We are still kind of dotting the I's and crossing the T's on this tenancy agreement. And specifically what's holding us up is our tenancy agreement with the county. So we're working with the lawyers right now to finalize that. Once we get that done, then we can more formalize the one with the the board we're working with now. And then we have a template that we can go out to other boards with.
Very good, Stephen. Thank you.
Councillor Van Passen.
Yeah, thank you, Madam Chair. When I read through this yesterday, I was wondering what kind of math that is possible when it was $50,000. They're requesting $93,650, and that's a 6.4% reduction in the levy requirement. And I'm trying to figure out how you can calculate it that way.
Well, the $50,000 was for 6 months. We were asking for a full year. So when you compare 6 months to a year, you have to double the 6 months.
No, net levy is, to my mind, is how much you got and how much you're asking for. And it seems to me it's an increase.
Yeah, no, but
like
I'm looking at it from our budget perspective, not from a net levy perspective.
That's how I did it too, but I don't think it's right. I still think it went up.
But we're operating a full year this year, so we're going to need money for the full year.
Anything further, Councillor Van Passen?
No, you know, we were going to close it down last year, and they came back, and I thought the intent that we're willing to fund it at $50,000 a year if they could figure out a way to make it work. I didn't think this was just going to be ongoing increasing requests year after year, but that's up to the budget committee to debate. Correct.
Well, and our 5-year strategy has always been to get to a point in 5 years where we're not requesting funding. But it was always my understanding, and the way it was presented was that we would need funding throughout that 5 years, which would decrease over time.
Any further questions? Now, Stephen, the only thing I had was in the notes you had that the capital, my understanding though was that you guys were going to provide some contribution to some of the capital expenditures.
So and we actually have a committee that's going to start working with the county on that. So from capital expenditures, it probably wouldn't be us specifically unless we set up a capital fundraising plan. More, we would support the application of grants for any of the capital expenditures. So that was kind of the discussion we've been having with Brandon and team. But we're just, again, it's early days for.
One of the big ticket items was always going to be meaning that Aoda compliance. Now, I'm just wondering, maybe staff can answer that. Because Linwood is now independent, does that mean they wouldn't fall under that requirement for 2025?
Thank you. Through the chair, to Mayor Top. We're still the owner of the building, Norfolk County, so we still have requirements for accessibility.
So, Shelley, wasn't that one of the huge, I just can't remember what it was off the top of my head. I thought there was like an elevator component that was going to be significant, and that was actually one of the barriers. So is that not something that the board maybe at this point in time needs to commit to doing some fundraising and stuff for?
Through you to you, Mayor Shaw, we'll go back and look at the forecasted capital expenditures, and we'll bring that forward to our subcommittee meeting. That Mr. Nunn has indicated there's a working committee working on that. So we'll have some discussion at their next meeting.
Okay, thanks. Any further questions from the committee? Thanks very much, Stephen, for joining us today.
Great, thank you.
If I could have a mover and a seconder to receive the deputation as information. Councillor Taylor, seconded by Councillor Huffman. All those in favor? That is carried. All right, with that, I think we're going to turn our focus over to corporate services for their overview and presentation. I think Shelley is going to begin with some brief comments, followed by Ms. LaPlante and Chris Everett, who is the Supervisor, Financial Planning and Reporting, and Jacob Graham, Senior Financial Analyst. To keep things going this morning, I will ask the committee members hold their questions and comments to the end of the corporate services presentation. And with that, Shelley, I will pass it over to you.
Thank you very much, Mayor Chop, and good morning to members of the Budget Committee. First, I would like to thank the Budget Chair and Vice Chair for their guidance throughout budget preparations and leading up to today's presentation. I'd like to extend my sincere appreciation to the Environmental and Infrastructure Services and Financial Management and Planning teams for the detailed analysis, review, and preparation of the budget and related report and presentation today. This morning, Budget Committee will be considering the 2022 rate-supported operating budget. As part of Council's strategic priorities for the 2019 to 2022 term, one of Council's guiding principles for success was to lay a strong foundation by undertaking the hard work in building a strong financial future and narrowing the county's infrastructure deficit. This budget continues the work towards Council's guiding principle. As such, the 2022 rate-supported operating budget will represent the second step in a 10-year plan where Council is working to balance the infrastructure needs of the water and wastewater system with financial affordability to ensure that Norfolk County can provide quality drinking water and wastewater treatment services. This strategy was approved through the 2020 rate study and provides users with known and sustainable rate increases while addressing the gap in annual life cycle costing. Based on the approval of this strategy, the philosophy of annual life cycle costing was the cornerstone used in the 2022 rate-supported operating budget development. In simple terms, annual life cycle costing considers the funds that should be set aside each year to provide for the required replacements of the water and wastewater assets. With that, I will pass it to Kathy LaPlante, who will provide some brief remarks and lead us into the formal staff presentation and Budget Committee's deliberation of the rate-supported operating budget. Thank you, and Kathy.
Thank you, Shelley. Good morning, Chair Chop and Budget Committee members. I'll be quite short also. Just as outlined in the report, the wastewater budget, also known as the rate-supported operating budget, before you today is based on a long-term financial strategy approved by Council last year through the rate study. The rate study included all current and future water and wastewater system capital and operating costs. Capital has been included from a life cycle and growth-related perspective. Through the rate study in 2020, Council was presented with two scenarios for the long-term financial strategy. Scenario A, smooth rate increases over the 10 years, while Scenario B, embrace the county's policy of full funding committed debt obligations in the year that the commitment is made. Scenario A resulted in a 6.6% increase in 2021, 6.3% in 2022, and between 5.1% to 5.4% from 2003 to 2029, and down to 3.2% in 2030. While Scenario B presented 11.7% increase in 2021, a 12.1% increase in 2022, and 2.6% from 2023 to 2030. Council at the time chose to smooth the rate increase over the 10 years and chose Scenario A. It also needs to be noted that any significant changes to infrastructure needs and/or operating costs or growth, etc., could have an impact on our long-term future strategy and rates. Therefore, as changes are firmed up, additional information will be provided to Council along with any financial impact. And in closing, I would like to reiterate Shelley's shout out to Catherine Fanny, Chris Everett, Jacob Graham, EIS, and all the financial services staff for all their hard work on pulling this budget together this year. And now I'll pass the floor over to Chris and Catherine for their presentation. Thank you.
Thank you, Kathy. I'm just going to share a presentation here.
I'm not sure if it's just me, but
we can't hear anything.
Okay, can you hear us now?
We can hear you, but we lost the
Thank you.
presentation.
Yes, I'll pull it back up. Okay, sorry about that. So in the opening comments, Shelley and Kathy addressed a number of the main points in our presentation. We're going to look at the targeted life cycle costing requirements, the proposed budget, the major drivers, and the overall impact on rates, including a look at the long-term forecasts. Now we'll start off with some information that we use to guide the decisions made relating to the rate-supported operating budget, our budget engagement results. To ensure the public was engaged in the 2022 budget process, an online public engagement process was implemented. Results of the survey, including questions related to water and wastewater services, were presented to the Budget Committee on October 12, 2021. The public engagement process also included a virtual engagement session on October the 20th. As demonstrated here, results of the survey indicated that approximately 53% of respondents who pay for water and wastewater services feel they receive poor or very poor value. It is anticipated that as the long-term plan progresses and the infrastructure and financial sustainability challenges are addressed, that the level of satisfaction will improve. Other guiding principles that were used in the 2022 budget preparation process were budget guidance, which was approved by Council on July 20th. This slide represents the guidance approved relating to the rate-supported operating budget. The main guidance recommendations are rates be based on the multi-year strategy adopted, which includes focusing on stable projected rate increases over the next 10 years and addressing life cycle costing gap while considering financial sustainability. As well, an additional special capital charge of 1% be included in the rates. Overall, guidance measures support the path taken by staff in the preparation of the budget. Rates presented within this budget align with the 2020 rate study to address the life cycle costing gap. As well, the additional special has been included in the 2022 rates. The driving factor behind the rate increases forecasted within the long-term strategy is the focus on targeted life cycle costing needs. The main principle approved in this plan was to increase the total infrastructure funding to be reflective of the average annual life cycle cost over a 10-year period. The continuation of this strategy was applied in developing the budget. The calculation of annual life cycle costing is based on the information from Norfolk County's asset management plan, which is currently being developed. The asset management plan includes a detailed inventory for water and wastewater capital assets. The average annual life cycle cost is then determined by dividing the rehabilitation and replacement costs by the average life cycle of each asset. The proposed interurban water supply investments were also considered in the calculation, as by the end of the 10-year period, the centralized water system is projected to be in place. To reach the annual life cycle costing target, Norfolk County needs to reach $18.9 million in 2022 dollars of infrastructure funding per year. This represents a further increase of $5.2 million as compared to the 2022 proposed funding as shown in the pie chart on the right of the slide. It should be noted that life cycle costing does not consider the current condition of the assets. Since costs are subject to inflation, the life cycle costs will continue to increase annually. This will result in yearly changes to the targeted level. This is demonstrated in the chart on the left of the slide. Now I'll pass it over to Catherine, who will take a closer look at the 2022 rate requirement, major budget drivers, and rate impacts for both 2022 and the long-term forecast.
Thanks, Chris. When looking at the overall 2022 budget, and more specifically at the rate requirement, 2021's net rate requirement was $22.2 million. When looking forward to 2022, this need has increased by $1.7 million to $23.9 million. Approximately $400,000 of the $1.7 million increase over 2021 is attributable to operating costs and revenue adjustments, while $1.3 million of this increase relates to infrastructure funding. As noted on the previous slide, this is a critical component of the budget in order to ensure that we are saving enough to pay for future asset replacements and rehabilitations, ensuring both operational and financial sustainability of the systems. And it also explains why it is the largest driver of the budget. Now let's have a closer look at the other drivers, or more detailed drivers, behind these figures. A variety of factors affect the net rate requirement on an annual basis. Due to the heavy weighting towards infrastructure requirements, operational efficiencies are less impactful than in the levy-supported operating budget. While operating efficiencies are less impactful, a few significant changes have been implemented over the last year, including bringing some of the SCADA contracted services work in-house through the repositioning of an existing position, resulting in $68,000 reduction to the budget for these services in 2022. Additionally, due to a change in service providers for the wastewater treatment contract, a further reduction of operational savings of $155,000 is estimated. Some other drivers include salary and benefit increases of $103,900 for merit, economic, and benefit increases, the dedicated purchasing support to deal with water infrastructure matters at $86,000 as approved by Council in 2021, an increase in the fire protection services revenue, which is supported by the levy budget of $150,000 based on the assumptions within the rate study, an estimated increase in the insurance charges of $47,600 due to significant increases being estimated in this area based on other municipalities and the market hardening. A decrease in leachate charges revenue of $388,000 is driven by the assumptions within the rate study. This will have a positive effect on the levy budget for waste management, and I will get into a little bit more details later on in the presentation. And the largest driver, which is infrastructure funding, as previously noted. This accounts for the majority of the $1.7 million increase to the rate requirement at $1.3 million. With that, the next question becomes, what does this mean for the ratepayers? Here we can see the impact of the proposed 2022 water and wastewater rates on the users of the system, as well as the impacts for the other charges in the system. For 2022, staff completed significant analysis on the net rate requirement, consumption, users, and the proposed rates that were forecasted as part of the long-term strategy that was approved. This analysis, in conjunction with validation from the rate study consultant, have confirmed that the proposed 2022 rates will generate sufficient funds to cover the 2022 rate requirement without the need to engage the services of the consultant for a more detailed review or recalculation of these planned rates. As such, the average residential charge increase is the predicted $6.27 per month, or 6.3% increase as predicted in the rate study. Septic and holding tank rates are based on the charge for the fixed costs providing the treatment plants and the operating costs required to treat septic tank and holding tank waste. These rates are increasing at 3.2%, which includes the additional 1% special capital charge for 2022, as noted in the budget guidance. The leachate rates are on a 5-year phase-in of rate reductions based on the findings of the rate study. The premise for this is that an analysis of the relative potency of incoming leachate determined that leachate has approximately the same potency as incoming waste and therefore should be charged at the same ratio per cubic meter, while allocating specific capital costs and infrastructure allocations accordingly. The 5-year phase-in will help to lessen the shift of the burden to residential ratepayers. The result is a decrease of 31.8% for the 2022 rate over the 2021 rate, including the 1% special capital charge. The bulk water rate incorporates an allowance for fixed costs for the water supply system, as well as a volumetric charge for the variable costs of operating those systems. With the 1% special capital charge for 2021-22, the impact on the bulk water rate is 1.1% over the 2021 rate charge. Now, we'll have a quick look at how the long-term strategy is forecasted to impact average residentials and users. In 2020, Council to a long-term plan with more stable projected rate increases over the following 10 years. Future monthly rate payers is presented on the graph and table here. Overall, the remainder of the forecast predicts approximate increases of around 5.2% annually. 2022 is higher due to the inclusion of the special capital charge as noted previously. In year 2030, a lower increase is predicted, as it is expected that the required annual life cycle costing funding requirement will be met at that time and will result in an increase closer to inflation. Since the budget for 2022 aligns with the forecast within the long-term plan, the projected rates have not required an adjustment. In future years, adjustment to the budget may be required to the rate impacts provided, which would result in a deviation from this plan seen on the screen. I'll now pass things back over to Chris to wrap things up.
Thank you, Catherine. To summarize our presentation, the proposed 2022 rate-supported operating budget has been prepared based on a business-as-usual budget in order to maintain current service levels and efficiencies implemented. In addition, as in previous years, this budget also includes further investments for capital infrastructure and continuing toward closing the $5.2 million annual funding gap between sustainable funding levels with full life cycle costing principles and the current funding level. With that, I'm going to pass it over to our budget chair for the next steps.
Sorry, just give me 1 second. I was just reading something in the agenda there. Okay, if I'm Kevin, maybe you can help me out here with how you wanted to jump with this, just from the chair notes that you had provided. Did you've got down that you wanted to move through the communication item?
Through you, Vice Chair Chop. Yeah, if you wanted to have the plan was to have everything moved as information as part of the staff recommendations. So the presentation, the report, and the information memo be received as information towards the end of the staff report, once as a part of the main staff recommendation. if I may add, if you had any questions regarding the memo, that's just to be received as information. I do not, corporate services can correct me if I'm wrong, but we did not plan to speak to that unless there was further questions.
Okay, I'm a little bit confused still, I'm not gonna lie. So, is it at this stage then you want to take questions from the committee to staff, or did you want to proceed with something else and then come back to that?
Thank you, Chair Chop. I can speak to that. I think your idea is great. If we proceed to questions from the committee at this time relating to the presentation, that would be great. And then we can perhaps move into looking at the budget package, including the information memo.
Okay, so are there questions from the committee at this time? Okay, no questions from the committee at this time. Councillor Huffman, I see your hand. Go ahead.
Thank you, Chair Chop. I do have a question. I've had quite a bit of feedback from residents regarding this proposed increase. And one of the common questions is, and I just want to kind of get it out there so that we can have a layman's explanation, is the dollars that are being spent towards infrastructure when we're looking at this major water scenario right now in terms of Norfolk County and putting many millions of dollars towards our future infrastructure. And I guess the question being, why would we have so much infrastructure in this budget when we've got a big upcoming project due? So if that could be discussed, that would be great.
Through the chair to Councillor Huffman. So just to clarify your question there, is it relating to why are we contemplating such a large infrastructure increase when we are contemplating a large project upcoming in the plan, the 125 million? Okay, perfect.
Yeah.
So that's an excellent question. So included in our plan to move to life cycle costing over the 10 years, we are including provisions for that project because it will be in place, the interurban water supply, at the end of the 10-year program. So as we're moving towards our $18.9 million in 2022 dollars, included in that target is providing for the annual replacement requirement for that system. So because the project has been initiated and has started, we need to start providing and providing the infrastructure requirements for those funds. So half of the project is funded from development charges. And then the other half right now is funded from the current users of the system. So the way we're including that portion is through the rates, and we're including debt that we're going to issue in the future within our budget to start providing for those capital costs that we need to take on in the future for this project. Does that answer your question?
Yes, it does. Thank you.
Councillor Columbus, go ahead.
Thank you, Madam Chair. I got two questions, and one is with respect to an email I received from a resident who indicated that the infrastructure for the interurban water supply will be in place for more than 10 years, 20 years, 30 years. So why are we trying to pay for it all over a 10-year period rather than long into the future?
Through the chair to Councillor Columbus, that's another very great question. So when we're looking at our average annual life cycle costing, we're looking at the value that provides the residents per year until the next replacement needs to happen. So what we're actually doing is generating the value of 1 year of service to the residents through our infrastructure costs. So that's another reason why we're choosing to finance this project through debt payments, because we agree with this resident that yes, this project that we're undertaking now and through the next 10 years will provide benefits to not only the current residents, but also future residents that will be hooked up to the water and wastewater system. So by funding the project through debentures, that spreads those payments over the long term to actually capture and make sure that the future individuals who will be benefiting from the system will actually be contributing to the costs. In addition, with the development charges being used as a source, for the project. That is also how we're getting some of that growth funding for those future users to be used for the funding of this project.
The second question is with respect to the interurban water supply, and what are the chances of going to the Ontario government to get some financial assistance to offset some of the cost to our ratepayers?
Yeah, that's another excellent question, Councillor Columbus, and through the chair to you. We will be looking at every opportunity available to discuss with the provincial and federal government as much as possible on additional funding. I don't know if Mr. Godbey has any further comments on that, but I believe this past year the mayor had requested a meeting with the infrastructure group at the Ontario government in order to start some of those discussions, but that meeting wasn't agreed upon. So I think we're trying, but I think as the project ramps up harder and more, we will be advocating more and more for the needs of those funds.
I would hope that the province helps us out here. Thanks.
So to follow along Councillor Columbus's question, assuming that we will get some funding, that portion remains to be determined. What is the chances of we decided as a council to add in the special capital levy? I'm struggling a little bit more and more with that. I mean, when you look at, it's always rationalized that it's only a $6 a month increase, but put that on an annual basis and then put that over, as you guys have in the one nice chart there, over a 10-year period. People's water bills have gone up $1,000 basically in 10 years from now from what they are currently. How difficult would it be then for us to go back and eliminate that special capital? Hopefully we will see not only funding, but an increase in those DCs. And then I guess my next question, Al, is what kind of research we've done into applying, a special levy, perhaps even to any new development, so that, only the cost of maintaining those, that portion, I guess, of the new project, what we would have spent on maintaining our current facilities and keeping them up to legislated standards, but that any new expansion over and above that will be properly funded by the developers.
Thank you, Chair.
No, go ahead.
Thank you, Chair Chop. I will start with the first part of your question, and then perhaps the CAO can help me out with the second piece. So when you're asking, in terms of the special capital levy, how difficult would it be to kind of turn back time and take that out for this year? So the reason why we had initially suggested to include the special capital levy was to provide us some additional cushion within our reserves. So you'll recall Kathy's opening remarks where she had initially said we had initially considered two scenarios last year when looking at the rate budget. And the scenario we chose was to smooth long-term increases however, our regular financing policy would have seen average increases of 11.7% in 2021 and 12.1% in 2022. So the reason why we added the special capital levy in years 1 and 2 was to provide us a little bit of cushion in our reserves, so that if things don't turn out like we think they are right now and we need some additional money, we have some kind of safety net in our reserves, because we're not raising the capital costs for this large project as quickly as we normally would within our financing scenarios. So should the committee decide to still go back and ask for this to be reconsidered, what we would suggest is perhaps approving the rates currently right now that we have in the study, and then us going back and re-engaging the consultant to just look at that and see what that means for our long-term plan. Because that additional 1% to our reserves in this year, it kind of helps us gain ground as we continue through the remaining years of the project, because it's embedded, or remaining years of the plan, because it's already embedded in our reserve contributions. So I would just want to take that back, review what that looks like with the consultant's support to determine what the rest of the rates look like through the forecast period.
Yeah, I'm not sure that I can approve that full 6.3 this year, not in a post-COVID world and so on, and not when I agree that that we have to, in the same way that we, COVID funding and we increased that reserve contribution this year much more than expected. I'm just not sure that I can put a special capital levy in when I still see us double counting in our 10-year forecast for the existing system that we have, plus the additional 125. And it just doesn't, until staff can provide more concrete numbers to the committee that, okay, we're not going to count plan A and plan B, we're just going to go with plan A and then adjust accordingly. It just, I don't know. It seems, yes, I understand we want to increase that contribution. Yes, it's giving us a little bit more of a cushion, but I also wonder, I don't have the figure before me of how much, that we put forward last year for things like hiring for this position that we're just doing now a year later. So I'm just not sure in a post-COVID world that throwing the special capital levy on this year is necessarily the way to go. Not without more solid figures. Councillor Hoffman. And Al, sorry, just to finish that other piece, I'm just so curious, the ability of whether or not there is an ability to apply over and above the DCs a special levy given the nature of this project, and or how advancing the payment, as some developers have expressed interest on several occasions of advancing those DCs, how that would change that 10-year outlook.
Mayor, to the committee. I mean, clearly growth doesn't pay for itself, and we are looking at all options in terms of, developers front-ending some of these costs. But I think your point in terms of trying to solidify the plan is the first domino that needs to drop. We need to solidify exactly what this plan is going to look like. We keep talking about whether we're hedging our bets or there's sort of a plan A and a plan B there. We've got some new growth numbers that have come our way as well that we now need to incorporate into the overall plan. So what I'm going to suggest is that within the next, I'm going to say next couple of months, we will have this plan hopefully solidified in front of council with the definitive timelines, costing, exactly what it means to our growth numbers, exactly how we can approach some of these growth pressures, i.e. the developers, and try to get them to front end some of these costs, tackle the province and the federal government and look for some funding and some grant opportunities as well. So I think there's a lot of options out there. I think that what you have in front of you is a solid plan. Is it ultra conservative? I think so. Is there going to be opportunities for us to reduce these costs, try to truncate some of these timelines, try to do some different things? Yes. We're just not there yet, but we will be there shortly. You mentioned the project engineer or the project manager. We are in the midst of the interview process. We will be starting some interviews this week on Friday, so we're hopeful that we will be able to get that dedicated resource in place shortly and start putting all these jigsaw pieces together and then provide a fulsome update to council very shortly in terms of what that looks like. So we hear you loud and clear. There's lots of opportunities there. Yes, we're going to explore every option we can to reduce and insulate the tax increases that are required and try to put those costs on other folks, including the developers. We're just not there yet, and we just need a little bit more time.
Fair enough, but then maybe we should be coming back and holding off on this until there is a little bit more. Like we talk about, we're having this debate about whether a plan A and a plan B is included in there, and I don't think that there is a debate. I mean, there's a well rehabilitation plan with money being put in over the next 10 years. If the idea is that we are fully online and all communities serviced by Nanticoke in 10 years, why are we still having well rehabilitated? Now, I understand the counter argument is that you're saying some of the costs for decommissioning, these plants haven't been included in this 125 million, but I would say that's news to council. I mean, that's not being presented. So to me, it's either present Plan A with 125 million that includes the decommissioning costs and then drop the other one, and then I can accept that. But right now, there is no debate. There is a Plan A, and the Plan B is also being included in there. And we're asking for residents that went through a 16.8% increase in 2020, or 16.3, 16.8 in 2020, and then another 6.6, 6.8, whatever it was last year, and then again this year. Again, I just find that difficult to justify having a special capital levy when we can't get done what we need to get done currently, and be able to provide concrete numbers. I mean, there's being conservative, and then there's being conservative. Councillor Van Passen, go ahead.
Thank you, Madam Mayor. I struggle with the same sort of false numbers that are in the capital budget. There's a lot of double counting on things, and it should have been sorted out. It's been delayed, but I also recognize very clearly that, in my opinion, over the last 20 years, the problem has been that they've only collected the money for operating costs. They've never put away any money for replacement. Always, I guess, on the hope that the money fairy would wave a magic wand and show up with a grant to the province. I look back to the economic downturn of 2008. I think over 2009, 2010, I remember seeing a lot of pictures of Diane Finley, our MP, showing up with the big phony check for a sewer plant upgrade in Port Rowan, Waterford, Simcoe, and I think they delivered over $55 million over the course of a couple of years to help fund those capital upgrades and capital repairs. And if it wasn't for that, we'd be another $55 million in debt because the work needs doing. But we've never set aside the amount. And, that's the shift we made last year, is to actually lay out a plan to develop a way to get that money. So, the new equipment's going to last 50 years, but at the end of that 50 years, you need the money to replace it, except they've never been accounting for that. This plan lays out a way to get there. If the money fairy does show up and, we apply for a grant for the well rehabilitation, or we apply a grant for the new water plant, and we get it, well, that money, it's easier to reduce a planned increase than it is to increase an increase. So, sticking with the plan, it's over 10 years. It's smoothed out rather than front loaded, but it needs to be there. We have to look at making it a whole sustainable system, and that's where this plan will get us. Now, I agree with your point of the 1% extra capital levy fee this year when we have $25 or $35 million double counted, and as our CAO has just said, that hopefully in 6 months we'll be able to clarify whether that's actual double counting or whether there's other costs not accounted for. But in the overall scheme of things, the price has to go up to set aside that money. And right now is probably the best time to get some of that work done, because it all going to be on borrowed money. We're never going to get ahead of the game. So the interest rates right now, I'd like to advance some of these projects rather than delay them. But I guess what the sense I'm getting from your bit of discussion, the 1% special capital levy increase in the post-COVID world, is it going to hurt a lot to delay that by 1 year when things would be smoothed out, cleared up, and everything else? So, I fully support a solid plan in place that our staff, can work with. But if there's some adjustments to be made this first year, I can support that as well. But again, I will leave that to the rest of you who have customers on that system, because I'm very limited on who I represent and who is hooked to the water sewer systems. But we need more money than what they have been doing in the past, and here's a way to get there, whether we like it or not. And yes, you know, the rule of 72 always applies. A 7.2% increase doubles your cost every 10 years. So we're just about there on this plan, aren't we?
Sure. I mean, I think the thing is, what's bothering me the most about this is we had the exact same conversation at the meeting last year where the double counting was still in there, and we're a year later. We keep talking about a plan, but I just don't actually really see a plan. But the only plan that I see is increasing rates without an actual firm plan to move forward. Councillor Hoffman, go ahead.
Thank you, Chair Chop. I'm with you on this one. I can't support the 1% special capital charge on behalf of my residents and behalf of, I mean, myself as a taxpayer. Opened up my hydro bill and my water bill at the same time last week, and my water bill is higher than my hydro bill. And it just keeps going up. And just in terms, one, when you mentioned the post-COVID piece, but also there just needs to come a time where we can't get blood from a stone. So I don't support the 1% special capital charge, and I would like to see a more concrete plan.
Thanks, Councillor Huffman. I see a hand up from staff. Did you want to make a comment on this portion?
Yes, Chair Chop and members of the Budget Committee. It's Kathy LaPlante speaking. So I appreciate all of Council's concerns and comments that they have provided. We do understand where you are definitely coming from, especially during COVID, that's and all the pressures that residents are under. I just wanted to make sure that we're all on the same page, and then I want to make sure that I caution Council that this is a plan that does have a lot of uncertainties in it right now. You've mentioned the duplicate. We have really looked at that duplication. We feel it's less than $10 million if there is a duplication. There is a lot of items that are still not solidified. Again, some of the decommissioning, some of the wastewater side, now that we do have a new contractor, once they get into their full operations, we expect or anticipate there may be some concerns on the state of the water treatment plants. However, again, that's undetermined and we haven't built that in. We're also concerned about, we still have an infrastructure gap. Whether or not we collect it now or we start working towards closing that gap, it's still going to be there. It's still going to increase. We agree that we are being ultra conservative. The $125 million, though, to me, I can't speak to that. But that may very well be $150 million when we do finally solidify and we have firmer numbers. So I just wanted to caution Council that we do appreciate it. This is where it's very difficult to balance the needs, the affordability. But just keep in mind the current infrastructure that we do have now, we do have an infrastructure gap that our reserves are not fully funded. As Councillor Van Passen had mentioned, we were funding operations and a small portion of capital in the past. And that's how we got into the situation where now that it's time to either replace our current infrastructure or go with an centralized service system or some other system, that we will still need the funds to actually fund and pay for those costs. And I would hate to see that in the future. Then you see really double-digit increases. And again, it's just a caution. We do understand where you're coming from. Thank you.
Thanks, Kathy. I guess I started with the special levy because that was the easiest one to go forward with. But when we see, can you talk to me a little bit about the reduction with the SCADA costs? What exactly what did we do internally that achieved that savings?
Thanks, Chair Chop. I think this is best answered by Mr. Godby, who's raised his hand. So go ahead, Mr. Godby.
Yeah, good morning, everyone. Thank you for the chair to council. It's a good question. One of the things that we had done was we had a very heavy reliance on a third-party contractor to perform all kinds of SCADA services. Typically, that was involving a lot of the programming that kind of is the backbone of our SCADA system for our water and wastewater system. So, we run into an issue with reporting or data collection, and we'd have to call in a third-party contractor in order to address this. We just did not have the skill set in-house. So over the course of the past year, through various vacancies or retirements within our water and wastewater operators group, we've actually repurposed one of the field operators that are actually in the field, in the trenches, or in the treatment facilities themselves, and shifted their focus of that position to being one of our resident SCADA experts. So we were able to successfully recruit a very capable individual who has great experience in dealing with our actual Norfolk County SCADA systems. So now that individual is a full-time staff member, it's drastically cut down our reliance on needing to call in a third party. So that's basically kind of the offset. As a result of that, basically almost a net neutral on salaries and benefits in that area, but we were able to cut out that after hours emergency response stuff to a third-party contractor and deal with that internally, as well as there's other aspects of our capital SCADA programs that now can be supplemented by this staff.
Thanks, Jason. Okay, so I've got a bit of a follow-up question. I was just that's great work in that area. As you talk about, net neutral on the salaries and benefits and that side, we obviously have, an increase as we do through the rest of the corporation with salaries and benefits. But what portion within the water and wastewater operations, maybe somebody from finance can answer this, or Jason, if you just want to touch on it, because I can't, I'm just drawing a blank on the name of the famed report that never saw the light of day until that first year of council, where there was the number of recommendations that had been presented by somebody that had been hired by Norfolk County by previous council to do a year-long study on our water and wastewater operations. And a number of recommendations were made that really weren't implemented, although we did change the ORO component. What we haven't seen, and I've been waiting to see, is a reduction in salaries in water and wastewater operations, because we've eliminated the overtime that has been presented as being unnecessary for years. As in the, checking of the systems, I remember in that report, we bring in this automation with SCADA and so on, but we're still sending out, employees every single Saturday and every single Sunday to go and do their checks when it's stated with the SCADA that, I think it was every 72 hours was what was actually required. Have we made any changes internally to that? Because I would think that we're paying out more than $100,000 in overtime for that. That's just my best guess. Well over 100,000, I'm sure.
Right, and through you, Madam Mayor, to answer your question, without stepping in things too deeply on that, it was the Walton report, is what you're referencing. In that, there was identified some potential savings that could be made by some overtime shifts. So that's something that we've been working on over the past year. One of those items being, how do you do, legislatively, we're required to do these 72-hour checks of our systems. So now with the SCADA systems that we have, we've been rolling out some iPads basically that are being used and can be used by operators, which are going to reduce their needs to have to actually physically attend the site. It keeps it all within our secure network. so that we don't have, issues with concern of getting hacked or anything like that and getting any of that data security issues. So we've been working with our IT department on getting that up and running with the hope that we would slowly wean ourselves off of it. At the end of the day, we didn't want to jump headfirst into, just cutting off this weekend checks that we're normally doing, physical checks, in favor of the iPads until they were sure that they were actually successfully working. So that's been ongoing with our environmental services staff through the course of the last few months. Our hope is that it's going to be rolled out sometime early in 2022. Now, I say this hopefully as there are significant staffing impacts that we're also managing. It does change some of the agreements that we have within our collective agreement as it relates to weekend rounds and distribution of overtime and that. So that it is being worked through. I can get
There's
more.
not a guarantee. I got to stop you, Jason. There's not a guarantee of overtime in the collective agreement to that end. I mean, it has been practice of what's gone on, and that's great that has been the routine. But they also did, the Walton report was with previous council. So add up that amount of overtime over the last 4 years, and yet in the same breath, this is where I struggle with all the studies and stuff that were requested this year, even for water and wastewater operation. What's the point if the county haven't gone and paid for the Walton report if none of the recommendations were ever going to be implemented? Because I don't know of any one of them other than the ORO requirement, which was this council that changed it. So it just, again, it's not that we're asking for minor increases out of the ratepayers on this end. It was 16.8 3 years ago, and then we're showing a 6 point whatever % for the next, 10-year time horizon. I don't understand how as the county that we can go and ask that when we're not even taking, simple recommendations and at least coming forward and say, hey, I know this sucks, but we're also doing everything we possibly can internally to manage those costs. Anyway, that's just my 2 cents. Again, I struggle with, let's have another, it's a couple other reports to come forward here, but then we don't actually, or studies to move forward, but then we don't actually do anything with them. Any other questions from council at this? Okay, Kevin, I think maybe if you can get me back on track here, I've just sort of lost that point in the
through you, Chair Chop, what we should be looking at is entering into debate for the staff report. Corporate Services can correct me if I'm jumping ahead of the game.
So I guess just to turn it back over to Corporate Services then, can you guys give a new figure, or do you need some time? Do you want to take a break? That sounded like there was an appetite to remove the special capital levy at a minimum.
Thank you, Chair Chop. So in order to calculate the new rates, we would actually need to go back and discuss with the consultant, because we do not have the rate calculator that was used to calculate the rate. So we'll actually have to go back and contact Watson to update those rates for us.
Councillor Van Passen?
Yes, thank you, Madam Mayor. We've been bouncing back and forth with the deputy clerk, but is the intent to receive the deputations as of so far as information? That's it, we're done. And then staff will do their report, CS 21-68, which is the little plastic covered thing that came out a week before. Is that where we are right now?
Through Chair Chop to Committee Member Van Passen, we can do that. We can receive the presentation, the information memo, and the staff report as information, and separate the question if it assists, and then we can work on the nitty gritty of the crunching the numbers and such with the finance team.
Yeah, 'cause it's
So the
CS.
point is, Councilor Van Passen, that's where I was confused as well. No, I think this is at the point where they want us to go and pass the rate.
Well, but the rates are, that's the recommendation out of CS 2168 that we haven't dealt with yet. So if you want to do it all later, but we need staff to present that report, CS, the one in the little plastic covered one that came a week early, so we had a chance to look at it. So if staff wants to present that, the final recommendation in that one is the one with real numbers in it and how much money we got to raise. So if you want to just have staff present that, we can carry on. So.
Let's do it. Let's go with that option. So I'll turn it back over to you guys if there's.
Thank you through the chair to Councillor Van Passen. So our presentation that we had earlier this morning was the presentation of the report, but I can definitely walk you through section by section here of our package just to see if the committee has more questions relating to specific areas.
I'm going to stop you, Catherine, just in the interest. So Councillor Van Passen, did you want to, I think it's better just to pick the areas that you want to go with. Again, that's where I had confusion as to what was going on here.
Oh.
But ultimately, that is what's being asked for, is passing the rate. So if you want to go line by line and start, I don't know.
No, that now that I would consider that report is the one on the table. That's the one that has the recommendations that says we need a net requirement of $23,915,400. So let's just say that that's the discussion on the floor right now. And if it makes it easier, I'll throw that out as a motion that we accept the staff recommendation, and then you can go and amend it by trying to figure out how to get rid of that 1% extra capital levy, if that helps.
Well, perhaps Councillor Huffman, since you seem supportive of that, perhaps you would like to move for the amendment for the removal of a special capital levy.
Sure, I will definitely move that motion that at this point in time that we do not move forward with the special capital charge of 1% on the 2022 wastewater budget, wastewater budget.
So with that, and Councilor Martin, I see your hand, but finance, in order to draft that motion correctly, did you guys want a few minutes?
Thank you, Chair Chop. So what I would recommend is, could we perhaps, and the clerk may have to help me out here with the wording, but we would have a better idea of the rates likely by next week. We can start working with the consultant today and what that would mean to our net rate requirements. So should the committee want to consider what the rates would look like without the 1% special capital charge, we would just request perhaps deferral. I'm not sure the correct wording here.
I'm just thinking perhaps we should just defer the entire thing until next week, and then it can be raised again. Does that work?
I would agree with that, Chair Chop. Thank you.
Councillor Van Passen, perhaps a bit unorthodox, but are you okay with that
I'm
move?
quite content that a deferral would take precedence over the amendment and over the original motion, and it can be deferred to full council next week. Staff know the information that's missing, and if I wouldn't want to make that motion because I've already got my name on the first one, but if somebody else would do the common sense thing and just ask that it be deferred, that would keep our deputy clerk very happy at that. So.
Councillor Taylor, thanks very much, and seconded by Councillor Columbus. All those in favor? That is carried. Opposed? Okay, I don't know if my camera's frozen because a couple of people aren't voting either direction here. So I'm going to call the question again. All those in favor? And opposed? Okay, 3 hands aren't going up, but perhaps I think the camera might be frozen. Now, either way, Kevin, that's carried.
Yep. Everyone had their hand up from my screen.
Hello?
Okay, sorry, I've got Councillor Martin, Councillor Michelle,
Yes,
and Councillor Huffman, but I think they were frozen. Thank you.
Hi.
Okay, so in that case then, I guess we'll just be a motion to adjourn, and then we'll be back for council and committee at 1 p.m.
Okay, all right.
Councillor Huffman, I think we might be hearing you.
Okay, that's perfect. Thank you very much. Okay,
I've muted her. Sorry.
Okay. We can have a motion to adjourn, please. Councillor Rabbits, I saw your hand. Thanks, Councillor Taylor. Seconded. All those in favor? And that is carried. And then we will be back for council at 1 p.m.